Okay, I'm gonna try to keep this short, but this will be my third pregnancy, and I had to have a C-section with my first because I had placenta previa, and that was definitely recommended with where it was at. I chose to not do a VBAC and get a second C-section with Lily, my second, just because I could have tried for a VBAC. I had a low-lying placenta. I was just honestly very scared. And then with this one, I found a new doctor. That's kind of what I wanted to go into with this video. I found a new doctor, and she recommended no VBAC after 2 C-sections. So we're going to go ahead and do another C-section. But this will be my third doctor. So I've had a different doctor for each delivery. My first was in Arizona. I loved that doctor so much. He was amazing. He closed my C-section with staples. It was perfection, let me tell you. Second doctor, we moved back to Ohio. I was 20 weeks pregnant. I had to find someone really quick. Honestly, not a huge fan of her. She was always super rushed. She was even very rushed in my C-section, like I could tell. And I could tell she had a rough morning that morning. She was like fighting with her husband or something on the phone before she came in. And I had like straight on panic attack when I was on the table there. That one was horrible. It's way different when you already have one kid, as opposed to that first one. Also, you don't know what you're getting into. So anyway, I will say with that second one, I did the clear drape, and that was really cool. I did like that. However, she closed me with sutures, and I ended up with a pretty big shelf. It's more prominent on this side. And I lost a good amount of fat after that one, and it was still there. Like, you can see it in colored leggings. It's just very annoying. So this new doctor I found, first of all, she's very straight shooter. I really liked that about her. She was super nice. Her staff was nice. Their facility was clean, and really, like, I liked the decorating. Like, I love when an office actually decorates and you feel comfortable there. It didn't feel like a sterile, like, hospital area. So I liked that. And she said that we could probably cut out some of that scar tissue it's kind of adhered there. I tried scar massage and all the things, and nothing has really touched it a little bit. So there's been a little bit of improvement, but maybe if I was more consistent. But anyway, now that we're having a third one, I was asking her about that, and she's like, yeah, we could probably cut a lot of that out. She's like, actually, I'll probably go higher, because she said my first incision is pretty low, and that might help a little bit with the outcome of how it looks. Obviously, a lot can change with another pregnancy. I'm gonna grow big again, so we will see. But I kind of wanted to share that, and I feel like if you've had multiple C-sections, you can definitely relate. And I just think that it would be really nice if we were able to get a little better care when it comes to C-section and post-surgical or post-C-section surgery standards and things like that. You know, they never recommend pelvic floor therapy. I've never heard any of my doctors recommend scar massage or anything like that. And I think they should, like, try to have it be aesthetically pleasing. Obviously, it's different if it's a emergency C-section, but can't we try to have it a little more aesthetically pleasing? Like, our body already changed so much. We're already going through so much. Like, that would be, I feel like that would just be so nice for us moms that have to have that done. We're already getting cut open through 7 layers. That would just be really nice. So anyway, my 2 cents on that.